Good morning, everybody. It is almost noon here, Japan time, and it is Christmas Eve, which is very exciting. I actually feel pretty calm today and pretty confident and happy all around. I landed a job which is pretty decent pay, but I'm working from home so I can still take care of my kids and everything. So my spirits have been higher than they usually are. I'm feeling really tired. The last week I've been getting very minimal sleep, maybe 3-4 hours a night. I've been really tired, as you can tell. The bags under my eyes are absolutely horrific. But as far as an update with my daily struggle with panic attacks and anxiety, I'm doing better, which is a plus, but it's something that I've struggled with for 5 years now. And it's something that I'll probably, deal with off and on for the rest of my life. And I've come to that conclusion just because I have had periods of time when my anxiety has been completely gone, and then I'll have periods of time where it comes back in huge and devastating waves. I'm drinking coffee on an empty stomach right now, which I'll probably regret later because caffeine makes my heart race, and then my heart racing leads to panic attacks and anxiety and, the whole vicious cycle. I have been seeing a therapist 2 times a month, and I've been seeing a psychologist once a month. I'm currently on Zoloft 100 milligrams, but he's wanting to up that dose and get more aggressive with getting my anxiety and my panic disorder under control. I really didn't want to rely on meds. I dealt with panic attacks and anxiety for so long before deciding to just get on meds and see how it does. I've just heard really bad horror stories, but so far my transformation from not being on meds to being on meds has not been that bad. I do have some nausea sometimes, some just fatigue, I'm kind of zonked out a lot, but I take that any day over panic attacks from the minute you wake up to the minute you go to sleep. I have been prescribed Klonopin as needed and Valium as needed, which I only take in emergency situations when I'm feeling triggered or feeling a panic attack come on. It just varies. I don't want to become addicted to that kind of stuff, so I'm trying to just take it when I really need it and when I need immediate relief from a panic attack. A panic attack for me is constant. It can start from early in the morning when I first wake up. I feel it building. Then throughout the day I'll feel it building more, and finally I'll have a full-blown panic attack, and my symptoms will include chest tightness, heart palpitations, vomiting, dizziness, vertigo, tunnel vision, blurry vision, cramping, pain, tingling in my arms, literally everything. I've been to the doctor a million times in the past few months, and I have really bad health anxiety, so anything that is health related triggers me. I can no longer watch any shows that involve medical stuff or movies that involve doctors or anything of that sort. A big trigger for me is blood pressure machines. I have no idea why. My blood pressure is always really high when I'm at the doctor's, but at home it's always perfect. My heart rate scares me a lot too. It's always really high. When I sleep, I know it's in the 70s, 80s, but throughout the day it's around 100, sometimes 120, 130. When I exercise, it's 130, 140, and it's scary to me. So I just wanted to update with what I'm struggling with and how I'm dealing with it and coping with it. I'm hoping to not stay on meds for longer than a year, and I'm hoping that therapy helps me a lot. And I'm really hoping that the start of the new year can kind of help me begin a new chapter and hopefully beat at least part of this disease. Thank you all for watching. Have a Merry Christmas.